Clinics with Nurse Shamila, the head nurse at Contour Clinics. How are you, Shamila?
I'm good. Thank you for having me today, Kesha.
Thank you so much for coming. So today we're going to talk about, I believe this is your favourite treatment, the cheek filler.
Yes, cheek filler.
So tell me, cheek filler, why is it your favourite treatment?
Look, cheeks I just absolutely love. I think a lot of people can have cheeks and it really helps to define structure, volumize the face beautifully, and yet it looks so natural.
Is everyone suitable for cheek filler, do you think?
Look, everyone's dependable. It depends, of course, on assessment. If you've got some volume loss or you're wanting a bit of contour, so it depends on what you're wanting, and then of course I'll look at that and decide the suitability of the candidate.
I've heard as well that the cheek can also support the tear trough, which is the under eye area. How?
Yes. So there's lots of benefits. Cheeks, when we look at the under eyes, it's probably one of the most trickiest areas to treat. A lot of it does have to do with a lot of your cheeks as well. So when we look at the tear trough, of course you get some hollowing, or some clients have hollowing, and then you kind of see that extension going down to your mid cheeks. So this is where we will often look at the mid cheeks as well to treat it before we look at the under eye. When we add that volume and support to the mid cheeks, what happens, it actually helps to elevate the tear trough and supports that orbital rim. So essentially it means we need less onto the tear trough itself. Yeah.
And can you use the cannula and the needle for for the cheek filler? Because I know that there are a lot of people that are scared of the needle.
Yeah.
So can you use the cannula
absolutely,
as well?
and it depends on clients' comfort as well. Kesha, so often if someone is wanting quite a comfortable treatment, I might opt to use a cannula, which just means one insertion points as versus two needles, where you can have multiple injection points. So it will generally depend on the client itself. I often, when I'm doing the mid cheeks, do prefer to use cannula because it just tends to go into different spaces much easily for us. Yeah.
So when you say it's more comfortable for a cannula, why is that?
It's just one injection point.
Okay.
That's it. So basically a cannula is a blunt needle, a little device that we use. So we open up, I can't even explain this. We use an entry point from the lower cheeks just to get that cannula through to the area that we want to get to, and then from there we can kind of finesse and move around and put the product in without having multiple injection points for clients. So it does tend to make it a bit more quicker, a bit more comfortable for clients, which is great.
I know that there are different areas of the cheeks that we can treat.
Absolutely.
Can you just go into what those areas are and what they treat?
Yeah, why we would do that. So, well, there's two main areas that I would look at. So we're looking at the medial cheeks, which is the apple of your cheeks overall, and then we're looking at the lateral cheek, which is normally that contour, kind of mimicking that cheekbone for clients. So often if I have a client where they're feeling, or they look quite hollow to the mid face, that's when we will add volumization to that area. And then any clients who's wanting a little bit more definition, a little bit more structural, maybe they don't have that natural cheekbone that most people are blessed with as well. We can go into contouring the lateral parts of our cheeks with adding a little bit of dermal filler, which mimics the bone structure.
When you're doing the cheek filler, after the patient's gone home, that night, do they have to sleep on their back? What's that? What's sort of
post-care instructions?
Yeah.
You mean? So normally, post any injectables, we want clients to not touch or rub the area because we want to minimize the chance of infection. So definitely no makeup. We want you to try and sleep on your back as much as possible. Of course, that can be sometimes difficult for the side sleepers, but try and sleep on your back so that you're not putting any pressure to the area, and just allow that filler to settle over the next few days. It is normal for it to be a bit tender post injections. It normally takes about 5 days to settle in beautifully.
Speaking of side sleepers, do you find that there are some people that are much flatter on one side?
Absolutely.
Is that supposedly because they're sleeping on the side?
Look, that can of course have effect on our fat pockets. So of course, if you're sleeping on the side, you're going to compress those fat pockets. And naturally, it's also bone structure. Some people just naturally have a side that they are a little bit more flatter, a bit more asymmetrical, but that's with most people anyway. Often I can tell when people sleep on their side because I do notice the cheeks tend to look quite flat and yeah, so the cheeks look quite flat, and even they tend to have a slightly deeper nasolabial folds as well. So we can generally pick that up.
So when you do the cheeks, that can also treat
Elevate,
the nasolabial
yes,
folds.
that's right. So it takes the weight of it. So when we have that lift vector on our cheeks, it means we're not putting as much pressure to the folds itself. Often when a client comes into clinic wanting to do the folds, I'll often look at the cheeks as well, the lateral components of it or the medial components of it, making sure there's enough volumization, enough support that lifts the face, and then I'll look into the nasolabials. The idea is when we come to the mid points of your face, you don't want to be putting too much volume. You don't want it to look unnatural as well. So less is always more.
Yeah, right. So that's so interesting that you would treat the cheeks first before the nasolabial. But I suppose that makes sense because it would lift, wouldn't
Yes,
it?
that's right. To support that lift, you have less pressure, and then overall, it means we use less product.
Well, guys, if you have any other questions about cheek filler, please DM or put in the comments below. Shamila, thank you so much for joining us today.
Thank you so much. This was a lot of fun. I can't speak.